Hello everyone, and welcome to our 18th and final episode in our pregnancy and postpartum series. Given this is our final episode, I wanted to share all of my tips, tricks, and secrets from conception through pregnancy to labor and delivery. I've been kind of saving up a lot of these things that don't necessarily fit in any one episode, and I'm going to give them all to you today. So, my name is Christie Amundson. I'm a physical therapist. I am now 37 weeks pregnant, and I'm going to be sharing with you some things that I've learned both through my profession in over 10 years treating pregnant and postpartum women in helping them through their challenges and pain through their pregnancy, as well as some of my own experiences, both bad and good, all the way from conceiving, surviving through pregnancy, and having a positive labor and delivery experience. So let's go. Okay, so the first few tips that I have more to do with both conceiving and kind of making it through that first trimester in your pregnancy. So number one tip is I highly recommend taking a methylated folate supplement. So folic acid is one of the most important things that pregnant women need to prevent miscarriage and then also prevent neural tube defects such as spina bifida. So one of the main components of taking a prenatal vitamin that you probably very so often hear that's so important to be taking if you're trying to conceive or if you are pregnant, especially in the earlier stages, is trying to get that folic acid. So a little personal story with this for me. When I was trying to conceive for my second pregnancy, I actually did have two subsequent miscarriages back to back, one at 5 weeks and one between 7 and 8 weeks. And unrelated to that, actually, here at Impact, we were doing some cardiovascular risk assessments. So we did a bunch of blood tests and we were able to get some results for those. And I was in my consultation for that and was told that my body, one of the blood tests that came out of that was showing that my body wasn't able to process folic acid as well. Normally when our bodies process folic acid, you need to attach a methyl group to it in order for your body to use it. And my body was not able to do that very successfully. And they were saying that they had no idea of my history of the miscarriages, but they were saying that can obviously lead to problems conceiving and problems with miscarriages. So they were highly recommending that I take a methylated folate supplement because of that and the cardiac risk that was involved with that as well, separately. But what I learned was I started taking that supplement and I was able to conceive, and I have not had any problems with miscarriages since. I certainly am not saying that this is the only thing that plays into fertility and miscarriages and trouble conceiving, but it is something that's very easy that you can do. It won't harm you to take the methylated folate version versus the folic acid. Actually, it's easier for your body because you're actually giving your body that supplement in the form that it actually can be used right away, as opposed to your body having to do work to use it. So this is the one that I take. You could probably just look at your either your pharmacy or your or online. If you look up methylfolate, I take a separate methylfolate supplement. However, you can find the methylated form in your multivitamin. However, most of the time, if you're taking a multivitamin, that it has to be usually like a higher end multivitamin. So some of the I guess cheaper brands of multivitamins won't have the methylated form. How do you know if it's the methylated form? If you look at the ingredients, so I'm going to show you this. If you look at the ingredients, you will see under it says folate, and then it says methyl tetrahydrofolate. So it's a really long word, but that's what you're looking for as opposed to just folic acid. And that is in its singular form with this. So if you wanted to just keep taking your multivitamin as is, and then just take this on top of it, you could do that as well. That's actually what I started out doing. The nice part about this is a lot of times multivitamins can be quite large, and especially if you're in the first trimester and you're having issues with nausea, sometimes you can't keep a large vitamin down or even stomach trying to swallow it. The nice thing about at least this particular supplement, I'm going to show you the difference in size, is it's way smaller than your typical multivitamin. And for my particular multivitamin, this is, they recommend taking 2 of these twice a day versus I just take 1 of these small methylfolates once a day. So I can link this particular one down in the comments so it's easy for you. But like I said, it's something that's super easy. You don't have to get the blood test to necessarily take this or even know that your body has a problem with that. But they did mention that it is not uncommon for women to have this, this problem. So if you are someone who's either trying to conceive or having trouble with multiple miscarriages, or you just want to make sure that you don't have problems with that, something just super easy that you can do, and then you at least can rule that out for sure as a source of the problem. All right, number 2, tips for nausea. Obviously, most of the time it's in the first trimester that you're going to get nausea. However, I have been blessed with this pregnancy in particular with having 3rd trimester nausea, which I had never had before in any of my other pregnancies. So that is unfortunate, but I want to tell you a couple of the tricks that not only I have found helpful, but also some of the patients that we have encountered and or some of my coworkers have found helpful. Generally speaking, they talk about anything cold being helpful, anything in the citrusy type flavors or peppermint being helpful. I would say generally they do make like they call them preggy pops that you can use that help nausea, that have really helped some people. I personally have found that I have gotten the lemon flavor of Italian ice, that I pretty much lived on that for my first trimester. Really helped me out. So check that out. It's nice and cold and it has a citrus flavor. It just really helped cut through my nausea and at least allowed me to eat a little something either afterwards, or if I ate something and was feeling nauseous afterward, having that and eating it kind of slowly really did help. Number 3 also has to do with nausea to a certain extent, but is just eat what you can when you can. So there's a lot of times, especially first pregnancies, we put a lot of pressure on ourselves to eat perfectly, have a great diet, exercise, and do all the right things. And then the nausea comes in and, all your body wants are, in my case, rice and cheese. So I just wanted to say, try not to put too much pressure on yourself in terms of from a diet perspective. Eat small amounts of food throughout the day if you can. There's a lot of people that it's been very helpful to keep like saltine crackers on their nightstand, so that even before you get out of bed in the morning, you can just have a little something in your stomach. That has worked well. I know, like I said, for me, for this particular pregnancy, all I was able to eat for a period of time was rice and cheese and soy sauce on that. So I just tried to do brown rice and low sodium soy sauce and limit my amounts and, did what I could for a period of time and got through it. So try not to put too much pressure on yourself to have a perfect diet, especially if you're nauseous, because a lot of times that will lead to more nutritional deficiencies rather than just, doing what you can and you're doing the best you can. Number 4 is drink more water. I know we've all heard that so many times, and you probably don't need me to tell you all the wonderful benefits of water in terms of swelling and blood pressure management and everything else like that. I found for me, there's a lot of people that prior to pregnancy had either a soda addiction or a coffee addiction, or maybe you still do, and you're finding it really tough to get through the day trying to limit your caffeine or limit some of those things. during your pregnancy. I have found that drinking more water, even when it doesn't taste that great, even in small amounts throughout the day and building up, can really curb your body's desire to have the caffeine, to have the soda, the coffee, because a lot of times what it boils down to is that your body was just needed to be hydrated. So I know I'm a fairly competitive person myself, so I got myself one of these giant water bottles. I feel like the video never does it justice, or the pictures never do it justice. It's like really large. It's actually a gallon of water. You do not need to get something this big. However, I liked that it had some kind of like benchmarks for the times throughout the day, and it kept me kind of competitively motivated. I did get this off of Amazon, but just trying to find anything that motivates you to drink water, and maybe that's if you put some lemon and cucumber in it or something like that. But whatever it takes to drink more water, it's also going to help you not only through your pregnancy, but into the postpartum period, especially if you're planning on nursing to keep your milk supply up. You do have to be drinking a lot of water, so it can help for that too. All right, so number 5 is my favorite exercise. I know in all of the episodes that you've maybe seen throughout this series, I've done a ton of different exercises. I have one favorite that I very often issue to patients for anywhere from lumbar pain, low back pain, pelvic pain, SI pain, sciatica. I really like it as a really quick, easy option to kick on your glute muscles, which will help kind of instantly give you some stability in your pelvis. And it's super easy to do if you work, and you don't even have to look like you're doing an exercise. So I actually went over this exercise in episode 1. So if you want, I'm going to quick show you here, but if you want more detailed instructions, you can always refer back to my pubic pain episode, which is episode 1. But basically it is, you're going to take one leg, you may need to help it depending on where you're at in the pregnancy, and cross it over, and you're going to clasp your hands behind your knee. You're going to shift to the opposite direction as the leg that's up. So when my right leg is up in this case, I'm going to shift to the left, clasp here, and I am trying to push my knee into my hands. And when I push, I don't want to lean to the opposite direction. So I want to stay leaning away from that leg. And I'm also pushing my back into the chair at the same time. So I'm engaging my abs a little bit. And you should feel it in your butt muscle, your glute muscle, on that side. And you'll just hold it and breathe. And the nice part about this is I could just sit here and talk to you guys, and you would never know I'm doing an exercise. So it's been nice that, you know, even as I continue to work and treat patients, as I'm talking to patients, I may just do this and they never know what I'm doing. But I'm actually stabilizing my pelvis so that when I get up and we're going to do an exercise, I can feel better. So super quick, super easy, and it can apply to a lot of different pelvic and back stability issues that you can use it for. So give it a try. If it doesn't work that well, please refer back to any of my previous episodes in terms of what your specific problem is, whether it's sciatica, SI pain, low back pain, pubic pain, any of that. I have separate episodes for all of it, and each of them has more specific exercise to that particular region or diagnosis. So number 6 also has to do with exercise, but get in the water. If you saw episode 15, it was our pool episode. I actually am allergic to chlorine, so I do not get to go in pools very often. And we were able to make it so that I could get in our pool to film that episode. And it was so glorious. So as far as a mode of exercise anywhere, or maybe even you're not exercising, you just want to be able to relax and take the pressure off, the property of the water in terms of the buoyancy just feels so unbelievable on taking the pressure off of your pelvic floor and your spine and all your joints. It feels wonderful. So whether it's that you're exercising in the water and you're actually going for like a cardiovascular or a strength workout, whether you're trying to find exercises to relieve pain or whether you are just looking for some relief and some relaxation, I recommend the water over any other modality when you're pregnant. We hear it all the time with all of our pregnancy patients that they, if they had the choice, they would live in there. So check that out and check out episode 15 if you're looking for some recommendations on what things you can do in the water. Number 7, people always giggle about this one, but do not stimulate your nipples during pregnancy if you do not want to wear nursing pads for the remainder of your pregnancy. And I say that sometimes people know what stimulated their nipples and sometimes people don't. So obviously it can be a partner or anything in that kind of situation. It can be something that you know that you did. It also can be something that you had no idea that you did, like even just not wearing a bra, walking around with a t-shirt. And just that gentle rubbing on your nipples is enough to stimulate them so that they start leaking. I've heard this a lot. There's nothing wrong with that. However, the downfall of it is that it often doesn't stop. So once you do start stimulating your nipples and they start leaking, you're probably going to be stuck wearing a nursing pad for the remainder of your pregnancy. I say this from personal experience because my first pregnancy, somewhere in the second try, I was researching all about, breastfeeding and nursing, and I came to a website talking about manual expression of breast milk, and I just thought I would try it on one side, and I was stuck with that side leaking for the remainder of my pregnancy. Again, there's nothing wrong with it. It's just kind of an annoyance. So if that's something that you already are dealing with, then next time maybe not to do that, but and that there's nothing necessarily wrong with it. But if you are earlier on in your pregnancy, just keep that in mind. All right, so number 8 is be flexible yet realistic with a birth plan. So a birth plan is something that, if you so choose, you can make regarding everything from how you want the lights to the music to the to the labor and delivery experience to go for you. I have had many patients who have been very specific and very detailed in their birth plan, to the point where when things don't go quite as planned or something isn't quite exactly matching up with their plan, they end up really disappointed at the end. So my advice to you is, if you are someone who wants to do a birth plan, I think that's great, but just remember to be flexible and be open, because really anything can happen. And I would want you to, plan for things to possibly go a different direction. And you don't want to walk away from your birth experience if maybe you hadn't planned to have a C-section and that isn't what ended up happening, as that was something that was a totally negative overall birth experience. On the other end, if you're someone who maybe doesn't come in with a birth plan, which is more, I guess, what I have done my last 3 pregnancies, I've gone in kind of, I'll just be flexible, I'll see how it goes, I don't really know. I'm just going to see what I can tolerate, and if it gets more than I can tolerate, I'm open to either having an epidural or having pain medications at that point. I was probably too far on the end of that spectrum. In all 3 of my previous pregnancies, I played it by ear to the point where by the time I finally asked for some intervention because of the pain, it was too late. So I have never had an epidural, not because I'm opposed to them, but because I always asked too late, and it wasn't an option for me. And in particular, my last pregnancy and labor delivery was even too late for me to have anything, which was not what I had planned, we'll say. So I'm looking forward this time to going in knowing that, if I think maybe I can handle it to a certain point, back that point up by quite a bit, and then request some type of intervention, especially with an epidural, because sometimes that does take a little bit longer for them to come, if you're in a hospital setting, for them to come set that up and actually administer that. So my advice to you is try not to be on either end of the spectrum. But so if you're someone who's really a planner, try to just keep in mind to be flexible and build some of that flexibility into your birth plan. And if you're someone who is a total kind of fly by the seat of your pants person, I would recommend having some type of a plan and just being aware. So number 9 is ask for or take help if it's offered. I know in some of my earlier pregnancies where I was feeling a little bit better than these last subsequent pregnancies, I definitely would, my husband would ask one of my older kids to help move some furniture around, and I was kind of like, wait, I'm right here, I can help. But as I look back at that now, after being kind of offended at the time, it was really a kind thing that he did for me, and I know now it's really not worth me moving that piece of furniture, because what am I proving by doing that, and potentially, hurting for another day because of it when there was other options. So this can go a lot of different ways, whether it's physical help, whether it's, and this is also after the baby is born, there's a lot of people that will offer potentially to make a meal for you or come and clean the house, or if you get any of those offers, take advantage of them, because it's very nice that you have people in your life that are willing to help. And or if you don't get any offers, please don't be afraid to ask for help, whether that is people in your life that are your support system, your spouse, your family, your friends, or even just your medical providers, asking about certain therapies and other avenues that you can get some help, whatever you need. And number 10 is one of my secret weapons for labor and delivery. So this is something that it's to learn how to separate your abdominal contractions from your pelvic floor contractions. So what that really means, this is actually really hard to do if you are as far along as I am. So it's something that I highly recommend you do earlier on in your pregnancy, or even if you are trying to conceive, you start working on. But basically, if you think about the role of your abdominals, when you crunch, it kind of pushes down. So in terms of when you're trying to deliver a baby, you want your abdominals to engage, to push down on the uterus to help expel the baby. Your pelvic floor muscle role is to actually lift and pull up. So obviously, if you are contracting your abdominals at the same time as you contract your pelvic floor, it's like one's pushing down and one's lifting up, and you don't make much progress that way. So to learn how to do this, like I said, it's relatively difficult to learn when you're really far along. But if you were to lie on your back, if you're further than 20 weeks along, you'll want to be on a wedge or be elevated. And you take like 2 fingers and you find your hip bones, and then you're basically going to drop inside your hip bones, drop your fingers down to feel your abs. And then you're going to work on doing 2 things. You're going to try to work on contracting your abdominals, relaxing your abdominals, and then contracting your pelvic floor, and seeing if you can separate those 2 things. A lot of times at first, our bodies kind of contract those 2 things together naturally. In fact, actually in therapy school, when they were teaching us how to, instruct patients on how to engage their pelvic floor that didn't know, part of what they actually tell you is to feel your abdominals, and if their abdominals are contracting, well, their pelvic floor is probably as well. So what you want to try to do, a pelvic floor contraction is like if you're going to urinate and you're trying to stop the urine flow. So it's like you're trying to pull up and in your vagina or urethra, and you're going to hold that. So some people call it Kegels. And then your abdominal contraction that we're really talking about is a really deep contraction of your transverse abdominis, which is the deepest muscle that goes across your belly. So again, if you're lying down on your back with your knees bent and your fingertips poking in your abs, what you're going to want to do is when you engage your abdominals, you should feel almost like your fingers are getting pushed out of your abdominals. And that's how you tell when they're engaging. So what you're looking for is when you do a Kegel or a pelvic floor contraction and you try to pull up and in with your pelvic floor, almost like if you're sitting on like a grape or a raisin and you're trying to lift and pick it up. And you want your fingertips to not be pushed out. In other words, you don't want your abs to engage. And then you're going to relax that and then gently, almost like you're trying to push your back into the ground. So you're not trying to do a big crunch, but you're going to try to flatten your spine into the table. And you should, again, if you're doing it right, you should feel those fingertips get pushed out of your, get pushed forward from where you're kind of digging them in. And that's when you're getting that good abdominal contraction. So what you want to do is practice one, then the other, and not both at the same time. So when you're doing your pelvic floor contraction, you don't want your fingers to be pushed out, and vice versa. If you're engaging your abdominals, you want to try to keep your pelvic floor nice and relaxed. So that way, when you are delivering and they're asking you to push, and you're actually trying to engage your abdominals to push, your pelvic floor isn't kind of trained neurologically to engage at that same time. You make much more progress and much faster progress that way. So that is something that has been kind of my secret weapon that not only for myself, but I know I've shared it with many patients and many colleagues, and I have gotten a lot of feedback from people saying, oh my gosh, that was the key to my delivery. I was able to, push for 3 times or whatever that looks like. Obviously, it's not the only thing that goes in, but it definitely makes it very challenging if you're trying to push and your pelvic floor is contracting at the same time. A lot of times that will lead to really long labors or a lot of tearing, a lot of potentially a C-section or any other vacuum extractions, things like that. So that's my one tip I save for the end. It's my main one. So that's 10 that we went over. My bonus tip is, I kind of alluded to it already, but just get help if you ask for help if you are hurting. So, and what I mean by that is if you're in pain, whether it's pelvic or back or upper back or shoulder, ask your provider that's managing your pregnancy. Go see a physical or occupational therapist. There can be ways that we can give you some relief. Obviously, there is eventually an end in sight, but usually we can get you to a place where you can manage a lot easier, and there's avenues to do that. So don't torture yourself. All right, I think my time is up. Thank you all so much for joining me on this journey, and I wish you all happy, healthy, fit pregnancies and deliveries, and I am looking forward to seeing you all back for some postpartum videos. So if you have any ideas of things you'd like to see for that, please drop them in the comments below, and hopefully I will see you soon.